Hiya, I'm Heidi Radke. I'm an orthopedic surgeon with an enthusiasm about developmental canine orthopedic diseases. In today's course, we will look into the most important orthopedic developmental diseases such as OC, OCD, elbow dysplasia, hip dysplasia, and conditions affecting the stifle. I hope you will learn important aspects to diagnose these patients early with the potential to make a real difference in these animals' lives. For the evaluation of the stance, we assess asymmetry or symmetry to see if any asymmetry is present. There are different aspects to consider. For example, the paw of the limb taking the most weight will tend to be flatter, and it will be more difficult to lift this limb up when the animal is standing. We may notice an inward or outward pointing of the paw. The animal may shift weight from the pelvic limbs to the thoracic limbs, or there might be a kyphotic stance. There could be scoliosis. There could be a shifting of weight. They may sit down, or that could be an indication that a problem is in the pelvic limbs, or if they lay down, that could be more a sign that there's a thoracic limb problem. Muscle atrophy may be present. All these are details we want to pick up when we assess the stance. And then we do a gait evaluation. There we want to watch the animal walk, and that usually means we need to go out of the consulting room into an area where the animal can be walked freely. That might be a corridor or an outside space. That should ideally be not frequented by many other people or animals, so that the animal and owner are not distracted. Also, I take notice if an owner has problems with walking themselves, then it might be helpful if somebody else trots and walks the animal. So all these are aspects to consider. We want to observe them at different speeds, surfaces if possible, also in circles. It can be helpful to see them walking up and down, some stairs, and we look for signs such as shortened stride length, abnormal joint movement, is there head bobbing, scuffing of nails, any signs of ataxia. Because the gait evaluation is also an important aspect where we could get some signs of neurological diseases present, and that's why in all these neurodiseases are important differential diagnosis. It's important that we pick them up in our examination, and therefore this needs to be run parallel in our head in all our steps of observing the animal. But then also when we do the palpation, we will do a shortened neuro exam as the minimum. And here we have some examples. Examples of how difficult it can be in a young boisterous dog. So you see the way away from us, this young puppy was just hopping along, but then when walking back more concentrated, it became very apparent that there was a forelimb lameness. So there it's useful to stop then, but also to find a way that the animal is not pulling on the lead. That makes it very difficult to observe, and then we can get concentrated moments where we can observe the lameness properly. Here's another example of a young boisterous animal. Can you continue to walk? maybe that's just short, I need to run that. The walker already pays attention so that the dog is not pulling on the lead, so that's very positive. It could help here to use a longer lead to get the animal a little bit further away to be able to observe. So this dog shows a hypermetric gait, which is not a typical sign for a joint problem or an orthopedic disease, but a more typical sign for a neurological disorder. And this young Great Dane was indeed diagnosed then with a wobbler, but also had an ununited unconeal process. So also we see combinations of diseases, and then it's important to be thorough enough that we diagnose each of the conditions. Because of course for treatment and diagnosis it does matter a lot to know the whole picture.